best food for your baby. It's easily digested and provides all the nutrition your baby needs for the first 6 months of his or her life. Babies who breastfeed have better mental development and emotional security. They also have better jaw and tooth development and stronger immune system. Breastfeeding begins right after birth and continues until your baby turns into 2 years old. For the first 6 months, you should breastfeed your baby exclusively. The importance of breastfeeding is to help you develop a stronger bond with your little one. Breastfeeding also, or the breast milk, is healthier than the formula because it contains essential blends of proteins, fats, vitamins, and minerals that nourish your baby and boost the immune system. Formula, on the other hand, can cause malnourishment and excess loads on your baby's organ. The benefits of breastfeeding for both mom and baby are the following. For the baby, first, we have the ideal nutrition. Secondly, it contains antibodies. Third, it may reduce also the disease risk such as the middle ear infection, respiratory tract infection, colds and infection, gut infection, sudden infant death syndrome or the SIDS or the SIDS, allergies, bowel diseases, diabetes, and childhood leukemia. And the fourth, we have the healthy weight for the baby. And for the fifth, it makes our children or baby smarter. And for the mother, we have these benefits. First, it helps the mother to lose weight. Second, it helps the uterus to contract. Third, it lowers the risk for depression or for the postpartum depression. And then fourth, reduce the risk for diseases such as the breast and ovarian cancer, high blood pressure, arthritis, high blood fats, heart diseases, and type 2 diabetes. It also prevents menstruation. And lastly, of course, it saves time and money. By applying the correct technique of breastfeeding, it can help ensure your baby latches on well and receive adequate intake of breast milk with correct positioning. And breastfeeding should not be painful. And these are the different types of breastfeeding position. The first thing that we have is the laid back position. For the laid back position, it is best suited for the newborn babies and the mother wants to rest. And this also, the babies are having little trouble on latching. And then the first thing that we need to do is to lie down on a supported reclining position, and then the mother should lie on some pillows for back support and not lying on their back. And then place your baby with his or her tummy down on your belly, and this will also help to foster the skin contact. Allow also the baby to find the nipple on his or her own and gently guide your baby if help is needed. And then for the second position, we have the cradle position. Okay? And then for the cradle position, it is best suited for all the mothers who wants to be discreet in public places such as mall, markets, or parks. And it is also the most common and easiest breastfeeding position. Cradle your baby in your arms on the same side of your breast. And then your child is feeling from the crook of your arm, who will also act as a pillow for your child's head to rest on as he or she is turned towards you. Okay? And then support your baby's bottom with your hand. And then for the newborns, their head and bottom should be in line. For older babies, you may lower their bottom down slightly and then support your breast if needed with your free hand. It is either right or left, of course. And then lastly, for the third position, we have the football position. This football position is best suited for small babies and then for all mothers who have undergone cesarean section and mothers with large breasts and short nipples. And then use your palm to support your child's head and shoulder at the nape of the neck. Okay? And then bring him or her up to mid-breast. And then support your baby's body and bottom with your forearm. And then tuck your baby under your arm so that his or her legs are behind you and the head is at your breast. For the contraindications in breastfeeding, we have the following. The first thing that we have is the using recreational and illicit drugs. Secondly, untreated active tuberculosis. Third, radioactive mineral used for diagnostic tests. And then fourth, known primary acute cytomegalovirus infection. And then fifth, the human immunodeficiency virus, also known as the HIV infection. Sixth, human T-cell leukemia or the lymphoma virus. And then seventh, we have the herpes simplex virus. Eighth, or for the last, we have the potential risk in hepatitis B and C. Next, what are the foods that we can eat or avoid when we are on breastfeeding? The first thing that we have are the fruits. Fruits are rich in a variety of nutrients that they may also aid in the relief of constipation, which some women have following childbirth. Aim for at least 2 cups of fruit every day with a wide variety of fruits such as bananas, mangoes, oranges, red or pink grapefruits, or melons. And then secondly, we have the vegetables. For the vegetables, breastfeeding mothers should strive to consume at least 3 cups of veggies every day. And then breastfeeding mothers who are also formula feeding should consume at least 2.5 cups of veggies every day. Vitamins and antioxidants are abound in vegetables. If you eat enough, your body will be able to replenish the nutrients that is needed to manufacture the milk, such as the spinach, carrots, sweet potatoes, pumpkins, tomatoes, and red sweet peppers. And then third, we have the grains. For the grains, it is particularly the whole grains like brown rice and whole wheat bread, okay? It also provides essential nutrients. If you're exclusively breastfeeding, you need to aim at least 8 ounces per day or 6 ounces if you are also a formula feeding. Protein is an important food to consume during breastfeeding, and some grains such as quinoa are high in it. Cereals that have been fortified with nutrients are likely a smart choice. It is best to limit yourself to whole grain cereals with no added sugar. And then fourth, we have the proteins. For the proteins, when breastfeeding, the body requires an additional 25 grams of proteins per day for a total of at least 65 grams per day. And then everyday meal or every meal should include some proteins such as beans and peas, nuts and seeds, and then lean beef and pork, oyster, crab, salmons, and sardines. And then lastly, we have the dairy. For the dairy, we have the calcium that can be leached from the bones during pregnancy and breastfeeding. If people do not have enough calcium and vitamin D, they are at the danger of developing osteoporosis, okay? And then dairy products such as cheese and milk are high in calcium, and many have vitamin D added to them. And then breastfeeding mothers should consume at least 3 cups of dairy products every day. Milk, yogurt, and natural cheese are all excellent sources of vitamin D and calcium. Always remember that, mommies. And then foods to avoid during pregnancies are seafood that may contain mercury, coffee, and of course the important most of all beverages or drinks is the alcohol. And for the foods that may increase breast milk are fenugreek seed, goat's rue, and oatmeal.